Hi, my name is Jeff Greep, and this presentation of Microsoft Business Intelligence for Healthcare is a class project for ISC 455 at the University of South Alabama. Business intelligence is taking data that is already available and transforming it into useful information that can be applied to many of today's decision-making processes. Microsoft has taken the approach where there's no need to reinvent the wheel, with new software additions to support. Their approach utilizes programs that are already in place by many hospitals and enterprises. These include Microsoft Excel, Microsoft SQL Server, and Microsoft SharePoint, among a few others. Microsoft breaks these into three components for their business intelligence: performance management, reporting and analysis, and data warehousing. Why do we need business intelligence? Business intelligence is important for cost savings, being the first factor. And it's difficult to put a number on the amount of cost savings that can be seen from using a program for business intelligence. Many factors within the organization are going to play into how much savings are actually seen. But one of the important things with the Microsoft Business Intelligence is that it uses programs that you already are using and are already available to you. So the cost that's involved is minimal. Improvements in margins, an example in the Business Week white paper, I have referenced in the final reference pages, indicates that Nemours, a pediatric hospital, improved their margins by approximately 2% per year, which is a pretty good margin. Resource utilization is another area where it can help. It can be seen in scheduling a staff as well as other resources such as rooms, operating rooms, procedures. Better allows for downtime in certain areas for maintenance and things like that as well. Patient satisfaction is also higher when their needs are met. This falls back to the amount of time they spend in the facility and if the time is quality time or lost in waiting. And finally, better patient care is provided when the information needed to support them is readily available. Now we'll talk about the risk factors involved by implementing or using a business intelligence program. Some of the things, like I said, this is based on a set of programs that may already be there and be in place by a facility. So cost part of it is minimal, but there is a time investment that will be involved. And that's going to involve also acceptance by the management and physicians at the facility. If they're not getting useful reports from the data that's being provided, then they're not going to see as much of a need to use it, and therefore, the time wasted will be not very wisely spent. Supporting infrastructure is another risk factor. Again, this is based on software that's probably already in place, but there may be some other things such as printing, network capabilities, and things like that that would need to be met in order to implement this across a large facility. And also the time involved with the implementation of the business intelligence. As you start out, you may not see as much benefit from it, but as you start collecting more and more data, that can be more useful in shaping the way you're making your decisions. Again, clean data is another thing that is going to be important. If you're starting off a new electronic health record and using it, then the data is going to be pretty clean. However, the data that's not considered clean is going to be data that might have been transferred in, and areas where it doesn't match up, in specific fields of your database and things like that. Those are the things that are going to cause problems with the reporting then. And then the integration is the final thing that's going to depend on the current product use. If you're using a product that's already based on SQL, this will integrate in with it nicely and give you pretty good results. However, if you have a proprietary electronic health record system in place, it's going to be a lot harder to make this implement in and to give you good data off of that as well. Now, how do we manage this change? This software package would change how the healthcare organization in which it was implemented by providing reports that could highlight areas of efficiency and inefficiency, allow for better decision support, and provide a means for tracking and improve utilization. Change could be managed by implementing a plan to train IT staff to begin with, because they're going to be the ones who support and help to develop the function required for reporting. And to ensure buy-in, it would be important to take an inventory of the organizational, departmental, and personal needs that can be tracked by this business intelligence program. Now, the alternatives that are out there, there are quite a few that vary. Some of them, like McKesson QBC, which stands for Quality Business Collaborative, is an integrated package that's part of their electronic health record package. And then you have SAP and Oracle, which are a little bit separate from those, and Cerner. These are all ones that basically tie into the data that's there and use it. The big thing is whether you have to buy new software off the shelf to support your needs for business intelligence, or are you using something that is already available. In this case, Microsoft is trying to do that as much as possible. For the project lifecycle, implementation of the Microsoft Business Intelligence would follow a standard systems development lifecycle. The end-user development or rapid application development are two methods that could be utilized to implement this into your process. Because Microsoft Business Intelligence is based on underlying products already well established, using their life cycles, there's no need to develop a further one. But like I said, the end-user development and rapid application, because these are already programs that are in existence and probably already utilized, it's just a matter of meeting them and integrating them into what you want to do with your business intelligence and reporting. For meaningful use, business intelligence is important to report meaningful use. Meaningful use is a government requirement, and it's basically gives you an overview of how well you're utilizing an electronic health record, the data that you're collecting, and things like that. These are all things that are required for reporting and can be accomplished with Microsoft Business Intelligence for Healthcare, just alone with the package as it is. Another component, Amalga, which is provided by Microsoft and not part of the Business Intelligence setup, is something else that can enhance the application of meaningful use reporting, but it is not required. In summary, Microsoft Business Intelligence for Healthcare uses products that are already implemented by most businesses. Microsoft has taken this approach, using tools that are powerful and already deployed in business, adapting to meet the needs of healthcare. Business intelligence allows for meaningful use reporting, and users can expect cost savings, increased resource utilization, and greater patient satisfaction. These are the references that I've used throughout this program, and anyone would be interested in seeing them. They are from Microsoft's website that talk about their business intelligence product, and the final two are white papers that also discuss further use of the Microsoft Business Intelligence for Healthcare and how it can help an organization. Thank you and have a great day.